it's one of the most fascinating things we've seen and we're puzzled with. So the way it started was that we, some years ago, I was in Qatar, and we had started a neuroscience institute there. As part of the Neuroscience Institute, we had created a very comprehensive registry. So it's a database that tracks all admissions. It just turns out that because it's a small country, all of them comes to one hospital. So we track all the admissions on a daily basis. And so at this facility, they admit 200 to 210 patients a month. And we've been following this for 6-7 years. And to our surprise, just when COVID-19 started, and that was in February. The first case was in February of 2021. 2021? I can't remember, 2020. So whenever it was, right? It's amazing how we forget. I think it was 2020, right? So that's when, over the next 3 months, literally the number of admissions they went down from 200, 210 to 160, 150. It just went down and stayed down until such time that the recovery started. So we made that observation. We published it in one of the BMJ Neurology journal. And then around the same time, we saw multiple other, all over the world, in fact. So they were work coming out of UK, very interesting work, that not only was there a decrease in stroke, which is what we were following, but MI and acute surgical emergencies, a whole bunch of things just crashed down during the pandemic. And then once the peak was done, everything started coming back. We actually have gone since then. The paper's in press right now. At the second peak also, things go down. So it was an opportunity to look at data from North America, South America, the Far East, Europe, the Middle East. So the meta-analysis basically was to get all these studies to see what kind of trends were there, because it was very important for us to know. Some people had reported from New York that COVID patients, their strokes were more severe, which we've also documented. But if you want an explanation as to why these numbers went down for heart disease and stroke, it's because there's two or three very interesting factors. One is pollution literally disappeared. Like, I have friends in New Delhi who told me that they've never seen the Himalayas in their lives because it's a dirty, polluted city. But they could see the mountains for the first time in their lives, right? So pollution is a strong prothrombotic. So it's microparticles that are in the less than 2 micron range. So they can cause thrombosis. So that was one thing. The other thing, which is paradoxical, it's something I wasn't aware of, is that exercise is really good to prevent heart disease and stroke. We know that. But if you have really bad vessels, then sudden movements can promote clots. They can dislodge clots. So by restricting people to homes, they were cutting down on their activities, which may, in the short run, have caused lower degree of injury. And the most intriguing and the most unfortunate one, which has a lot of credibility to it also, is that people just were too scared to come to hospitals. So they were just staying home and having their events and dying at home. So there is data that unexplained mortality increased in many places.